Good afternoon and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We're here to navigate your journey to wellness, but we like to do it simply without all of that confusing medical terminology that everybody hates. We are here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, you can come see us at Naturopathic Physicians Group to help get your life back.
Today we will be talking about arthritis, specifically osteoarthritis, but we will touch on other forms as well. So let's talk about what arthritis is in general. It is basically inflammation or swelling of one or other joints. There are over 100 conditions that can affect the joints, which includes the tissues around the joint and other connective tissues. And some of the more well-known arthritic conditions, like I said already, one is osteoarthritis. This is the most common form. This occurs most frequently in the hands, the hips, and the knees. And some refer to this as the wear and tear type of arthritis because it typically comes on at a later state in age.
Yep, old injuries, if you broke a bone when you were younger, much higher risk of getting osteoarthritis. By far, probably the number one thing I treat in the office, at least as for myself as a practitioner. I treat probably 5 or 6 of these a day, 5 days a week. So it's pretty steady because what I do works. Mm-hmm. So we'll get into that later in the episode.
Yeah, there's also rheumatoid arthritis. So this is an autoimmune inflammatory condition where your body attacks its own joints, can be very painful, very inflammatory. Gout is another type of arthritis. It's very painful, typically affects one of the big toe joints, usually appears in only one joint at a time. If you've ever had gout, you would know it for sure.
You would know it. This is a 10 out of 10 pain when it hits you. And oftentimes the first time, if you have your first gout attack, you will be at the emergency room because it's so painful. It's out of nowhere and it will look super swollen. It'll almost... They'll think they have an infection because it's so swollen so fast, but the pain is so excruciating that they don't wait to see a doctor. They go to the emergency room. And then there's also psoriatic arthritis. This is a chronic inflammatory condition of the skin and the joints. So the psoriatic comes from psoriasis, so they will start to get plaques and patches and rashes associated with their pain and stiffness and swelling in those joints. This can happen. Oftentimes, people will blame it on like eczema and also have joint pain when it might actually be a combination condition.
So let's dig into the most common form of arthritis. That was the first one, osteoarthritis. Some symptoms that you might feel if you have osteoarthritis would be pain with movement, headaches possibly due to weak ligaments. Your pain will be worse with movement. Like if you're walking and your hip or your knee hurts, but it does not hurt when you're walking, then that's probably because of the movement. And that's how osteoarthritis affects you. Sleep can be affected, just getting worse over time. Like you're waiting for it to go away, but it's not going away. It's just getting worse. One of the telltale signs of osteoarthritis is if you have stiffness in the morning when you wake up, but oftentimes then it feels better pretty quick. But as the wear and tear from the day occurs, then it gets worse.
Yeah, so when you first get up in the morning, you're really stiff, you move around and you're like, oh, it feels better. You're getting those joints lubricated, so you feel a little bit better. But as the wear and tear from the day happens, that inflammation will trigger and you will feel that pain. When it comes to osteoarthritis, when I treat patients with this, one of the first things they tend to say improves is their sleep. Because if they're waking up due to pain or when they wake up, they're in pain, as they're healing, their body is not hurting as much. So they get up in the morning like, wow, it's not as stiff. I'm able to get up and, be okay. So rheumatoid arthritis, let's talk about that. So this one is autoimmune. So you're going to get a lot of systemic effects with along with the joint pain. So people with rheumatoid arthritis, they do get that swelling oftentimes in their fingers. It can cause finger abnormalities at the knuckles. And when you see people with chronic and uncontrolled rheumatoid arthritis, you'll see that their fingers will have deformities. They'll be turning in directions fingers are not supposed to be turning into. And that could be a sign of autoimmune rheumatoid arthritis.
You can see that some in osteoarthritis as well, like the big knuckles and the curved fingers. The difference between this is that rheumatoid arthritis is inflammatory. Like it is red and hot and swollen. And it actually shows up on x-rays as inflammation as well. Rheumatoid arthritis can also cause brain fog. So when you think about this being autoimmune, it may also come in pairs or groups with other autoimmune conditions, because that is the tendency of autoimmune disease. They like to hang out in groups. Dry eyes, glaucoma, and even conjunctivitis or pink eye and dry mouth can be part of rheumatoid arthritis picture.
Again, think systemic. It can cause GI issues like constipation. You can get ulcers. You can get anemia where your red blood cells decrease. It's a bad one. And honestly, a lot of people with rheumatoid arthritis think they have osteoarthritis for many years and gets undiagnosed. But if you have other systemic symptoms as well as you have joint pain, it's one of those ones you need to rule out. The other thing with rheumatoid arthritis, oftentimes they're not painful with osteoarthritis, they're painful in the morning, then they feel better. This one, oftentimes they don't have pain in the morning, and then as the day goes on, it gets worse, but then at the end of the day, it gets better as well as they're lubricating. So it's almost like an opposite of what osteoarthritis will do.
Mm-hmm. Yeah. Because it's autoimmune, there can also be like lung issues. So, and there can be even the rheumatoid arthritis can affect the red blood cells and the arteries and the heart. So all of those systems can be affected.
And we already talked a little bit about gout. Again, sudden severe joint pain, joint stiffness. It's caused by uric acid buildup into the joints. So you get this crystallizing into the joints, and that's where you experience the pain. So oftentimes with gout, you need to lower that uric acid in the body in order to get the pain to go down. But that can take some time. And when people are in that chronic gout flare-up, they are hurting and they need results. So a lot of times they're going to get painkillers. They're going to get drugs to lower uric acid quickly, but they're also going to be given those painkillers, which can be habit forming and very problematic. And of course, we'll get to that later in the show.
Yeah, mild fever can show up with this. Now, we typically said gout shows up in the big toe, right? But it can be a little confusing sometimes because it might show up in a knee or an elbow or something
joint
like that. Yeah. So thanks for tuning in to Your Health is Wealth. We are Dr. Stephen Katz and Dr. Loreena Ryder from Naturopathic Physicians Group. We're in Scottsdale, Arizona. On our show, we give you practical information to take charge of your health, help get your life back. Today's topic is arthritis and how to become pain-free again.
Every single week, I do a segment called What Isn't Your Doctor Telling You? This is not an anti-doctor segment. However, if you're going to your doctor for pain and you don't want surgery, you're probably going to the wrong person. So I'm going to give you a tidbit every single week, and we're going to try and help you on your journey to wellness. So with me saying that sentence, it's not because I'm trying to be mean to the other side. The truth of the matter is the other side uses a lot of things that I would deem as very questionable when trying to actually heal a patient. They love to do anti-inflammatories, they love to do steroids, which weaken the issues, and they love to misdiagnose and treat you. What I mean by that is very often your orthopedic doctors and your doctors that are treating pain are solely relying on the scans that you have received. Now, I am not anti-MRI or X-ray. I use them as well. But I don't just rely on those X-rays and MRIs. The reason why that's bad medicine is because you have to do a physical exam. You have to take the patient and you have to check the areas because MRIs show damage. They don't show weakness. Weakness in the ligaments, in the tendons might not show up on an MRI, and that might be your cause to why you're developing arthritis, why you are having pain in your hip, in your back. A perfect example of this is if you go to an orthopedic doctor and you say you have low back pain, they're going to likely run an MRI on your low back. In that process, they're going to look at the lumbar spine. The lumbar spine is not the main cause of most people's low back pain. However, if you are over the age of 40, you likely will show some damage in the lumbar spine. Therefore, they'll run your MRI. They'll see, oh, you have damage in your lumbar. Let's treat it. And now they are treating your lumbar spine when that might not have been the cause of your pain. The most common causes of low back pain is your SI joint, your iliolumbar ligament, and your glutes. None of them will be checked on a lumbar MRI. So again, be careful before you jump into surgeries and steroids and everything like that. And if that's all your doctor offers, oftentimes it might be a good idea to get a second opinion.
All right, let's talk about some of those traditional diagnostic tests. So there are X-rays and CT scans. Those are pretty much the first line of imaging that a doctor will use. They both use a small dose of ionizing radiation to produce images, if that's something you're concerned about. An MRI scan, these are, I would say, my favorite, uses magnets and radio waves to create the imaging, so there's no radiation there. So you're not exposed to radiation with an MRI like you are a CT scan or an X-ray.
So when the X-ray is used, it sends radiation through the body, and areas with high levels of calcium, so that's going to be your bones, your teeth, that's going to block the radiation, which will make the appearance on the image to look white. Soft tissue allows the radiation to pass through, therefore those will look gray or black on the image. So they're going to show your bones really, really well. So they would use an X-ray for somebody with suspected fractures, breaks, dislocations, joint space decreasing, like with arthritis. Arthritis is much higher in a condition out there called EDS, and patients, even young patients, can show up with issues like that.
So the T-scan stands for computed tomography scan. This sends radiation through the body like an X-ray does, but at a higher level, creating computerized 360-degree views of the body's structure. A CT scan is best for small fractures that aren't visible on a standard X-ray, possibly blood clot and organ injuries. Now, the CT scan is similar to the X-ray, like we said, but just much, much stronger.
And then, of course, MRIs. Again, that's probably my favorite. It doesn't have all of the junk from the X-ray and the CT scan because it's using magnets. And it's a non-radiation process to do that. But it also gives a much more detailed picture. It shows structures, including soft tissue, nerves, and blood vessels. So people with spinal injuries, compression injuries on the nerves, cartilage loss, muscle tears, any kind of cartilage injury, any type of arthritis, strains, sprains, tendons, ... This will show it. Even cancers can show up really nicely on these images. So people with pain, MRIs are your go-to. Unfortunately, with insurance, as we all know out there, they'll probably make you do 40 scans before they'll approve your MRI. They're going to make you do your X-ray, do your bone scan, sometimes they make you do injections first. They're like, well, why don't you try a cortisone shot first, and then if that doesn't work, we can send you for an MRI. So they make you run through the process. Oftentimes, people are in a lot of pain and they don't want to deal with this process, but that's the insurance.
Yeah. Well, the nice thing about MRIs, they've been around for a while. They've been doing a lot of them. Cash pay pricing for MRIs is quite reasonable these days.
Yeah.
So
it's a hidden secret to scans. Sometimes your insurance is worse than paying for it. I've seen this. A lot of places that do MRIs, you can get them for $400, $500, $600. Now, it's still not a cheap test, but when you go through your insurance, if you still have deductibles and stuff like that, they're going to bill your insurance price the insurance price rate, and then you're going to get a bill based on that. So oftentimes people tell me they'll pay $1,000, $1,200, $1,500, if not $2,000 for their MRI when they could have went without insurance and paid a few $100.
Yep.
So again, it's worth looking into sometimes, as the MRIs aren't as expensive as a lot of people think.
Yeah. So let's see here. Do you want to talk about the scans?
Well, I mean, in general, when we use scans, again, I love scans, but they're not the end all be all. The end all be all is that physical exam. We use the physical exam along with your scans to diagnose you correctly and then also pick the correct treatment for you to help heal the body. If all you're using and if all your doctor is using is scans to determine everything, you need to be careful with that because they might be treating you, they might be injecting you in areas that are not causing your problem. Everybody over the age of 40 is going to have some form of arthritis in their body more often than not. If they're using that as your sole cause of pain, you might be treating something that does not need to be treated, which will make you worse.
All right, let's talk about those traditional treatments. So painkillers are used, anti-inflammatories are used. We mentioned steroids and surgery. When you go to the conventional doctor with joint pain, arthritic pain, this is what they will be using as their first line of treatment. So let's talk about why this is bad. So opiates, first thing on the list, and painkillers. I think by now we all know that's a bad idea. Now, Tylenol, although it's not the best for your liver, it doesn't slow healing processes down like other over-the-counter pain meds, and it's not an anti-inflammatory. So if you have to use something to get you through the day, that would be the choice. Now, narcotics like hydrocodone and oxycodone, these are addictive. The opiates are dangerous, the narcotics are dangerous, and one of the leading causes of deaths in the country. And they're just addictive.
They're highly addictive. I spent 2 years doing rotations in drug and alcohol rehab, and we were trying to get people off of opiates left and right. It's a nasty drug. It's very easy to get addicted to these drugs if you're doing them daily. And when we say, Tylenol's the go-to, it's weak painkiller, so it's the go-to comparatively, but it's still hard on your liver. And if you're doing it every day, it's still terrible for you. I mean, aspirin is horrible for your stomach. Tylenol is horrible for your liver, and ibuprofen is horrible for your kidneys. So it's not like any of them are good to do, but it's all the more reason why you have to treat the pain correctly. Because if your go-to is painkillers, you are doing nothing to help that pain. You are just masking it, and eventually you're going to need higher doses or higher or stronger drugs in order to get that same relief.
I've had this show up on blood labs, like if somebody is taking Tylenol or ibuprofen on a regular basis and they're showing up and their liver or kidneys having a hard time, I'm asking them, like, you're young, what's going on here? Why is this lab level low? And when we figure it out, sometimes it's either the Tylenol or the ibuprofen. Mm-hmm. And when a patient sees that on their labs in real time, then they all of a sudden realize, oh, this is damaging me on the inside.
Or ulcers in their stomach caused by aspirin. Every time you take aspirin, your stomach bleeds. Put that in your brain. Your stomach does not like aspirin, and it bleeds. And so when that happens, if you keep taking aspirin, every single day, you have a much higher risk of an ulcer. Now, again, I know a lot of people do that for their heart, and we're not telling you to stop meds. We never tell you to start or stop anything, but understand that ulcers are very common with aspirin use, and it's just part of the process.
Yeah. Speaking of those anti-inflammatories like ibuprofen, diclofenac, Celebrex, and aspirin, they actually slow down or possibly even stop your body's healing process. And that makes your injury last longer. So even though you're temporarily relieving the pain with that anti-inflammatory, your injury is going to be a longer process.
And then they love steroid pills. If you're really inflamed, steroids can be a godsend because they're going to make you feel better faster. Problem is, steroids and cortisone and injections, they will make your injury last longer. They block the immune system's capability to do the healing, so you feel better while the steroid's there, but every time you do it, it gets a little bit weaker and weaker. They even say don't ever do more than like 2 or 3 cortisone shots in a certain joint because that injury is going to get worse and worse. Well, that's because it's blocking your immune system.
I mean, there's research there that shows that the steroid injections degrade the joint.
Yeah, they make your immune system weaker and your joint gets weaker. But that's where I have issues with like the conventional side too, because I've heard even conventional side that do natural treatments like PRP that work amazing. They'll be like, let's try a cortisone first. And then if that doesn't work, we'll do PRP. So let's weaken the ligament before we try to heal the ligament. It's absolutely dumb, and I hear this all the time. Mm-hmm. So thanks again for tuning into our show, Your Health as Well. We're the doctors from Naturopathic Physicians Group. Our phone number is 480-451-6161. We are talking today about arthritis and how natural treatments might be the way to get your pain away and get your life back.
I'm glad you're going on vacation next week.
Oh, man, I'm going to hear that one at home. Get your pain away. I'm a much better doctor than speaker, I promise.
Well, and it's Friday. This is Dr. Ryder here with your tip of the week. Let's talk about types of collagen. It's kind of a buzzword out there these days. Collagen peptides are super trendy right now. So collagen is our body's primary building block of skin, muscles, bones, and tendons, and ligaments, and other connective tissue. There's 5 types of collagen. So type 1 is the most abundant type of collagen in the body. It makes up 90% of your body's collagen. Type 1 is densely packed, and it's used to provide structure to your skin, your bones, your tendons, and your ligaments. So people who have EDS or Ehlers-Danlos syndrome have defects in that type 1 collagen. These are the circus performers that were contortionists, and these are the people who are considered double jointed and have like super bendy joints. Type 2 collagen, this is found in elastic cartilage, and this provides joint support. Type 3 collagen is found in muscles, arteries, and organs. Type 4 is found in layers of the skin. Type 5 is found in the cornea of your eyes, some layers of the skin, hair, tissue, and placenta. So those collagen peptides out there and the collagen supplements, they're typically 1 and 3 types of collagen. The important thing to remember here is that type 2 collagen is the most effective type of collagen for joint health. It's the main component of joint cartilage. The powdered collagen that does have type 2 collagen should and usually does contain type 1 and 3 as well. So it is easy to incorporate this into your diet. Another great thing about the powdered collagen, not the capsules, but the powdered, if you're trying to add more protein into your diet, this could help increase that protein number of your macros. So protein's another buzzword out there. Get more protein, get more protein. Collagen's an easy way to do that. Usually just 2 scoops of that unflavored collagen in a hot liquid like coffee or tea can bump up to, maybe several, like 18, 20 grams of quality protein in your diet.
Nice. Mm-hmm. So in the last segment, before we get into the naturopathic treatment options, we're going to finish up real quick on the traditional. So if the drugs haven't worked or they've given you a bunch of steroids and now your joints are like non-existent and you're bone on bone, the last step is surgery. It's what the number one thing I see in the office where people are trying to prevent, because I do so much pain treatments in the office. But surgery generally has about a 50% success rate when you're talking about joint issues. Again, replacements can be godsend for people in a lot of pain. But if they're trying to not get surgery, if they're trying to prevent that surgery, there has to be better things to do, and most of the conventional side is all the break down the joint before the surgery versus try to repair the joint. So again, surgery, every time you do surgery, the success rate goes down. And you hear a lot of people say, well, I've had 3 back surgeries, I've had 2 shoulder surgeries, and every time you do it, that success rate goes down because you're weakening those tendons, you're weakening those ligaments, you're putting artificial things in your body, and the body has to adjust to the new you. And that oftentimes throws other things off.
I mean, when I'm talking to patients about the option of surgery, we have a real conversation. And like you said, sometimes it can be a godsend. Sometimes surgery can be the most amazing thing for that person. However, there's no guarantee of it. You don't know if you might be that percentage of person where it fixes it, or you might still have the same problem, or you might have worse pain or pain somewhere else because of it. So a lot of the time, patients will not want to take that chance and that risk. And so that's why we see them in office to help them prevent that surgery.
Yeah, I mean, so when we get into natural treatments, I mean, obvious one is keep moving. It's funny because that's the cheapest form of treatment you could possibly get. When you stop moving, your joints get weaker. The lubrication in the joints gets worse, and your joints become more and more arthritic. You have to move around, even though it is wear and tear for osteoarthritis. If you don't use them, you will lose them. And so when people become more sedentary, their aches and pains will get worse faster. Now, day to day, taking a break, I hear people all the time, when I don't use it, I feel okay. But that's a short-term okay, because if they continue to do that, they're just going to make the injury worse and worse.
Let's talk about prolotherapy. So prolotherapy is probably the oldest injection that is used to help with joint pain. It is made of B vitamin, B12. We put a little bit of lidocaine in there just to be nice.
Yeah, so you don't hate us when we're done.
And dextrose, which is just what you think, sugar. So most of the time people are like, but wait, isn't sugar bad? Well, if we put dextrose, which is an inflammatory molecule, into an area that needs healing and needs repair work, that sends signals to the body, hey, we have an issue here. We have some inflammation. We need you to send all of your repair workers to this area and fix it. And that is exactly how it works.
And that's also why when you do anti-inflammatories, you get worse and you don't heal, because they're blocking all of that blood signaling by being an anti-inflammatory. So the injury's still there. You feel better because the swelling goes down, but the injury is still there and it's getting progressively worse. And then you have to take more and more of the drugs. But any time you think about it, like, this was the stupidest thing ever invented if you think about it from an inflammation as bad component. Inflammation is not bad. Too much inflammation isn't good, but inflammation is part of your immune system. It's a signaling agent. So when you bang your elbow and it gets inflamed, that's a signal to your immune system to say there's damage that needs to be repaired. Now, every time you skip a step, you have a significantly stronger treatment. So the second component of the regenerative injection therapies is platelet-rich plasma therapy. This is one of the most common things I do in my office because this treatment is amazing. Platelets are your healing cells. So we draw your blood, we separate the healing cells directly from your blood in high concentration, add a little lidocaine again so you don't hate us when we're done, and then we inject those healing cells directly at the site of the injury. I have seen people with tears repair with this treatment. I have seen near bone-on-bone repair with this treatment. Chronic injuries, people that have had injuries for decades do amazingly well with PRP. It is a godsend for so many people, and it's so much less invasive and so much less downtime than with surgery.
Yeah, very true. Dr. Katz and I are both patients of prolotherapy and PRP in our own office because, I mean, it really has helped both of us tremendously.
Yeah, I mean, after my car accidents, PRP is what helped my neck by far the most. Mm-hmm. And when I've had, and unfortunately, I've been a frequent flyer on those car accidents. But that being said, I mean, PRP, I didn't think twice. I'm like, I want PRP. Adjustments are good. E-stim is good. All this stuff is good. But I'm like, I want PRP because I want to repair, not just treat symptoms.
Yeah, for sure. Now, we do have a concentrated or stronger form of PRP. We use an Xcell kit. And what that does is basically allows us to get the most concentrated version of those plasma cells that have the healing factors in them as possible. Because it comes in kit form, it's more expensive, and we need extra equipment to be able to get that concentrated dose. But the pro of this is that you need less treatments because it is more concentrated and it packs more of a punch. I've had both. The Xcell, I can tell that it's more concentrated and packs more of a punch because I was definitely more sore after this one, but still manageable, not that big of a deal.
And I have had people do PRP in the office that said they did PRP somewhere else that got results in our office and didn't get them at the other place. And that is because a lot of people that do PRP do not do it correctly. They focus on single joints versus treating areas. When we treat people with pain, we treat areas and you get better.
Your Health is Wealth, our weekly show on how to take charge of your health and get your life back on track. I'm Dr. Loreena Ryder alongside my co-host, Dr. Stephen Katz. Today, we're talking about arthritis.
So we started talking about regenerative pain treatments that we do in the office, but now, not everybody is a needle person. We understand that. We don't always love needles ourselves. That doesn't mean we won't get them because it's so effective. I'm not an anti-needle person, though.
You love needles.
I love needles, but not everybody does. So we also have an option for you if you are not a needle person. We have something called shockwave therapy. Shockwave is a non-needle, non-invasive treatment that involves delivering shockwaves to injured soft tissue. So this is a treatment you don't have to worry about the needle, but it penetrates into the connective tissue, stimulates an immune system blood response to the area, and heals. It's an awesome substitute for people that just don't like needles.
Mm-hmm. Don't be fooled, though. This thing packs a punch as well. Like it's kind of painful.
Yeah, I mean, it's not a pleasant treatment, but it's not a needle.
Uh-huh.
A lot of people, it's not so much about the pain from the treatment, it's more the needle itself. And so this is a great option to heal. I mean, in the end, don't you want to feel like you're doing something to heal? When you do treatments like this, you can't walk away and not know you did a treatment.
Yeah.
And again, there's a lot of people out there, they're like, well, watch and see what happens. I'm like, well, I'm kind of the person that says, I want to know I felt something where I feel like something's happening. And none of these treatments will leave you disappointed with that.
Yeah. So, yeah, shockwave or the injection therapies, you will definitely know you had a treatment afterward. Let's talk about some supplements. So if over-the-counter anti-inflammatories make injuries worse, what about natural anti-inflammatories? Generally speaking, they are okay, with the exception of white willow bark, which is just basically the natural form of aspirin. Most natural anti-inflammatories are more regulators than chemicals that shut down pathways down. So therefore, if you have too much inflammation or even not enough, the natural supplement generally helps that balance.
Yeah, again, inflammation gets a bad rap. That doesn't mean you want too much of it, but again, inflammation is part of our immune system. So we're going to start jumping into supplements that we have used with our patients. Remember, every time we talk about supplements and medications, we are not telling you to start or stop anything. We are just giving you information, and we are telling you certain things we use with our patients. But as we say almost every week, we treat all our patients as individuals. Therefore, just because we use this for one person does not mean it's right for you. So always discuss with your provider on whether or not this is right for you. So our first go-to that we love, you already talked about it in your tip of the week, is collagen. Collagen is the building block to connective tissue. This helps with tendons, ligaments, joints. This also helps your hair, skin, and nails, which most people like as a nice side effect with that. But not all collagens are created equal. There are some good ones. There are some bad ones out there. So we tend to want people to use grass-fed, organic, clean collagen, generally from beef, but there's also organic chicken ones out there as well. If you are a vegan, there are some good vegan options as well, but they tend to be less effective than a lot of the non-vegan options for collagen.
There's some fish collagen out there too that is decent. Glucosamine is a great supplement that can help form and replace the collagen in the ligaments, tendons, and joints. Glucosamine helps improve synovial fluid production. This is the lubrication that helps make your joints move more efficiently without pain. Glucosamine's better when added to chondroitin. So a lot of times when you purchase a supplement, it will be a glucosamine chondroitin combination.
Yeah, and this one is, in my opinion, not as good as collagen, but it's still effective for a lot of people. I've had a lot of people say, I definitely got improvement when I use glucosamine and chondroitin. But there's also vitamin B7, also known as biotin. Biotin is also oftentimes a vegan option for people that don't want to take collagen. It helps build that collagen back up. So it's a nice one. It also helps with hair, skin, nails. It can be neuroprotective as a good B vitamin. It helps protect the nerves. It helps people with mood, energy. Biotin's been linked to helping people with bad cholesterol. So we love the Bs when they're used correctly on the correct patient.
How about curcumin or turmeric? So they're basically the same plant, just one has more healing properties than the other one. That would be curcumin has more healing properties than turmeric. Over 6,000 peer-reviewed journals have been published on the benefits of curcumin. This is one of the strongest natural anti-inflammatories out there. It's great for brain health and memory, detoxing of the liver, and also with pain.
And pretty much good for most people and everything. Vitamin C is a natural anti-inflammatory. You cannot make natural collagen without vitamin C in your system. So if you are low in C, oftentimes you have pain. It also helps regulate your immune system. It helps fight off infections. It helps with wound healing. I mean, we do a lot of vitamin C IVs in the office for people that are sick acutely, but also people who have chronic issues, including pain, and the vitamin C does help.
There are studies out there that show boswellia or frankincense decreases pain and stiffness with rheumatoid arthritis, osteoarthritis, and gout. This is a really great natural anti-inflammatory as well. Same as ginger, natural anti-inflammatory used for joint pain and inflammation. This improves mobility in both arthritises, osteo and rheumatoid. Ginger is also helpful in the digestive tract with nausea, and some news article reviews praise its capabilities for pain compared to arthritis meds and without all of those side effects.
Now, I know you said earlier that white willow bark can affect some of the healing. That doesn't mean it's not a good painkiller. So white willow bark is where they came up with the idea for aspirin. So it is a very strong anti-inflammatory. It also can thin the blood a little bit like aspirin does. It's not nearly as strong as aspirin, but we can't really have a pain and arthritis episode without talking about white willow bark. That being said, it is definitely not my first go-to because I like to heal people. And to me, white willow bark does not help that.
Mm-hmm. Astaxanthin, I think there has been an uptick in education, or it's kind of the new buzzword here. Astaxanthin is a vitamin A antioxidant. It inhibits overactive inflammation. It is useful against chronic diseases such as heart disease. It decreases free radicals that create damage in the body, and some suggest that astaxanthin is even stronger than vitamin C when dealing with inflammation in the body. Now, some people will use this to help them avoid a sunburn. So the astaxanthin, I think, is related to, is it that pink coloring in flamingos? I can't remember.
I thought that was shrimp.
Well, yeah. Let me look it up.
All right, fair enough. What about fish oil? We can't have a pain episode and an inflammation episode and not talk about fish oil. Fish oil is a great anti-inflammatory. Those omega-3s in there are awesome. They're great for brain health. In all honesty, a lot of people don't realize that you need inflammation. Again, we said it because it helps with your immune system, but it's about a ratio. It's about a balance. Omega-6 is inflammatory. Omega-3 is anti-inflammatory. You want your body to be about a 4-to-1 or less ratio of omega-6 to omega-3 to be properly balanced. Unfortunately, in America, the standard American diet is about 14 to 16-to-1 inflammation to anti-inflammation. Therefore, they need more anti-inflammatory to help them, and fish oil will help balance that out. Now, when we tell people fish oil, again, you want wild caught. If you're getting farm-raised fish, you are getting junk and horrible things. Plus, the smaller the fish, the safer. The larger fish carry a lot of toxins. There's still toxins in the smaller fish, but nowhere near to the extent of the larger fish. So smaller fish, wild caught, lab tested, to make sure they're not high in heavy metals is the best way to go for fish oil.
I have an answer on the astaxanthin.
Yes.
So flamingos get their pink color from astaxanthin. Flamingos are not born pink. They develop their pink color from the foods that they consume. The astaxanthin is a carotenoid pigment found in algae and small crustaceans like brine shrimp that they eat.
So we were both right.
Oh, you're worried about who's right.
Yes, of course.
Okay.
So I said shrimp. Yep. Thank you, flamingos.
Yeah. Astaxanthin.
That's the first time ever a man has been proven right.
Mark it
live
down.
on the radio. Mark it down. It'll never happen again. So another thing for now, non-supplement diet and weight. If you are excessive with weight, if you are obese, gravity is not our friends. It will continue to compress those joints and increase your pain. Therefore, losing weight can definitely help with pain. And of course, if you're eating bad foods, we talk about food all the time on this show, avoid your food allergens. 80% of our immune system and a lot of inflammation comes from what you eat and from your digestive tract. So if you're eating like crap, you will feel like crap, and that is exactly consistent with your joint pain. Thank you, everybody, for joining us today on Your Health is Wealth. We're here to help navigate your journey to wellness and help you take charge of your own health and increase the quality of your life. It's often simple and it works. We are the doctors from Naturopathic Physicians Group, Dr. Stephen Katz and Dr. Loreena Ryder. Please join us again, and we're going to have another hopefully fun episode and try not to bore you on medical talk. Have a great week, everybody.